I will.
All right. First help, correct?
Yes. We thought one of their strengths that they had the 3 medical hospitals.
Okay.
And they also they have all major accreditabilities in there besides, like, as far as Cape Fear not having it. They're very busy and they service 15 counties. Weaknesses was kind of hard for us to find because we really don't know much and they didn't show the bad side on there. But the mission statement was not available. We tried to find it. And then they don't have enough beds, you know, as far as the different facilities. That
According to who?
According to their website.
Yeah.
The website said.
They only have 459 beds.
Yeah.
So who determines that that's enough or not enough?
Well, if they're servicing 15 counties.
So this was an assumption that you got. Okay. All right. So that's good. All right. So not enough beds.
And then as far as the opportunity, then they have room for growth as far as like making either the hospitals bigger so they can have more beds. And then the online information, it really sucked. There wasn't very much information. And then the threats, overpopulation because of them being small.
And this you found on the website, or this is another assumption that you came to?
I guess you could say it's an assumption.
Okay.
We also thought that they offered a little bit too much
Services?
Yeah, because I mean they went all the way down to swimming lessons and all that. And then the commute, like say if somebody here needed to go there, that could be like a threat because they have certain things they offer there that they don't offer in this area, and then that might take away their patients as well too.
Okay. Oh, okay. All right. Let's talk about Cape Fear. Who's gonna talk?
They offer a variety of different services.
Okay.
That covers head to toe pretty much. They just increased their security within their facilities.
I was there last week. It's much tighter.
They've
Oh, yeah, it
received
sure is.
many different awards for their different types of healthcare services that they provide. The location is central, and they have many different locations to make it convenient for their patients.
Okay.
They give back to the patients within the community, which puts their name out there. A weakness is they do have long wait times in their emergency
One second.
rooms.
I want to make sure that you're listening.
I'm sorry.
Go ahead.
They have long waits in their emergency rooms, and there's been a lot of complaints about it. And we think that could be a possibility for them being either understaffed or their employees are inefficient. They've had lawsuits and bad press within the past 10 years. And that's also a weakness, is making them seem weak within the community. Opportunities for them to grow would be more involvement in the community. They only have 6 foundations that they give back through.
Okay.
They could maybe expand on that. The relationships with other hospitals.
Okay.
They could expand on that. They do offer scholarships for nursing students, and they could expand on that as well, to provide them with more employees, maybe better employees.
Okay.
Threats would be, of course, first help of the surrounding hospitals like Raleigh, Wake Med, Duke, UNC, the state and federal investigations that they just went through for neglecting the care of their patients. That was a definite threat.
Okay. All right, we're going to go back to first help and talk about these a little bit more. So we'll start with the strengths. 3 medical hospitals. I think I'm okay with that. I'm sure. Accreditations is important. When patients are looking for places to go, they want to see who's accredited, what type of awards they have. So I'm okay with that. Busy. Let's talk about this one.
Well, we thought it was a strength for their hospital in general because
They
the
give
opportunity
out-
for growth.
They give out a lot of funds, so they gotta have anything somewhere.
So you're saying that them being busy is a strength because they're making money?
No, they're not. They're nonprofit.
No.
They donate to.
So help me understand why, my question is, I want to understand why being busy is a strength.
That means that they offer something good to keep people coming.
Not necessarily, because over here you said somewhere that a lot of surrounding counties depend on them. So they may not be good if they're busy, people just may not have anywhere else to go.
Well, they only have 3 major hospitals, but they have 15 off-site.
My point here is, this could be a strength, but
It
the
could be a
reasons you
weak-
have given me so far would cause me to erase it.
Because they have like, what was it, 36,000 discharges.
A good way that you could spin this is kind of what you just said. If they're busy and they're productive and they're serving the community, they're getting people in and out, that's one thing. But to just say, we have a strength because we're busy,
And they employ over 4,000 employees.
that could be a strength. It's not up here, but that could be a strength.
Yeah,
You get what I'm saying?
We forgot that and our donations.
So, I'll put a question mark about that one. Serving 15 counties, I'm okay with that. Weaknesses. Mission statement not available. I'm okay with that because it's something that should be easily accessible for the community to see, for the people that work there to see. It should be easy to find. Not enough beds. I'm okay with this, but as I asked the question earlier, how do you know it's not enough beds?
Well, if they're doing that many discharges and seeing that many patients.
My question is, but have there been complaints about it?
Oh, no.
If they're doing this many discharges and there's no complaints, that could just mean they're productive. They could be totally okay with the number of beds that they have right now. Now, if we saw somewhere that they had a long wait time or something, then this would be okay. But if we don't have anything to justify that there's not enough beds, then it might not be a weakness. Now, something that could have gone here, again, coming back here, they're serving all these surrounding counties. So how accessible is this hospital really to everybody? So accessibility might have been a weakness that you might want to put here. If people are having to drive 30, 45 minutes to get to the hospital, yeah, they're servicing that area, but they're still having to drive that far.
But that was my question. Are we talking about the whole organization
Yes,
in general?
Yes.
They do have, they have
satellites.
satellites
So then
all,
that would have been,
all over.
Yeah.
Yeah, that was within the 15 counties.
Okay.
There was everywhere had satellite facilities.
all right, so we'll keep going. Opportunities, room for growth. I'm assuming this is like expansion, right?
Mhm.
So I'm all right with that. More online info. I guess I'm okay with that. You were saying that they just overall need to improve their online presence. Okay. I feel like there's probably more that you could have came up with though. Here. We'll come back though. Threats. Overpopulation. Let's talk about that one.
Within
Well,
the
we
three
put that-
three major hospitals, the 3 major that has it all, you know, the heart center, the cancer center. With only having that many beds, you are at a great risk of overpopulation.
Maybe. I I think you can argue that. Offer too much. I'm okay with that because sometimes you want to make sure you're not spreading yourself too thin. So, but this comes back to the point that if they're providing services to so many different counties, they may have to offer these things because they may not get it anywhere else. So, and the commute, we talked about that.
And see, I think that could fall under strengths too.
The commute.
Commute, because a lot of people on the other side of post can be referred to them instead of,
How far would it be though?
it's not far, I mean, they're first.
So we could consider that to some areas is convenient, but not to others.
Mhm.
Okay. All right. I'm gonna go ahead and go down here since we don't have that much time.
Yeah.
So was this is supposed to be variety, right? The first one
Yeah.
of services.
Yeah.
I'm okay with that. Security, I'm okay with that. Awards, I'm okay with that. Location, Fayetteville, location.
They have several different locations. They have several different,
So you mean convenience location?
yeah.
Okay. Gives value to patients. I'm okay with that. If it's in line with their mission. Weaknesses, long wait, definitely not something good, right? Lawsuits.
Now I have a question about that long wait. Was it on the line, or can that be considered an assumption too? What if you've never been there before?
Well,
I pulled it up off the news,
article or something. Yeah.
5 to 6 hour
5
wait.
to 6 hour wait.
Okay.
And I'm assuming you pull the lawsuits. I mean, I've heard about it.
Oh, yeah, that.
All right, now this understaffed. Let's talk about that one.
Yeah, that was an assumption based on the long wait.
I'm okay with that. We have proof that there's a long wait, so it's probably because of staffing or inefficient employees.
I would just say the latter of the two in that hospital.
Yeah. Opportunities. Now, we talked about this on Tuesday. You don't want to contradict yourself. Up here, we talked about the fact that they give to the community, but down here, we say more.
To be more involved.
So if they need to be more, is it a strength? I'm just posing questions. Kind of contradictory a little bit. That's like saying, you're a really good nurse, but you need to be a better nurse. You know what I mean?
Yeah.
Okay.
So,
We'll take it back, because they can, they're a big institution, they can do more.
all right.
I think they're capable of doing more.
So then I'm okay with that.
I don't know, maybe they need to focus on their long waits.
In relation to other hospitals, was that just something you found, or?
I didn't come up with that, so I don't know.
It was more like something that I read, like they can expand with other hospitals.
Okay. And scholarships. I'm kind of about this one. If they're already doing scholarships for nursing students, then a better opportunity might have been something like, let's try to look at providing scholarships for radiology techs.
Maybe they should get into like the colleges and stuff.
Or something, meaning if they're already doing this, an opportunity, a better opportunity might be
Partnership.
doing something else
Like
besides what they're already doing.
partnering with the community college for like
Right.
medical transcript, I don't know.
But you get what I'm saying?
Yeah.
They're already doing this, so.
Right.
Threats, first up, competition, right? This is definitely, because if they lose,
That's their name.
yes, that's their name, that's
They're
their
threatening
brand.
their own name.
And I'm assuming this is also just
Yeah.
other hospitals. So overall, I think you guys did a pretty good job. A few times kind of strayed away, but overall, I think what was important is that you kept the organization at the forefront when you were trying to figure out what these threats are. And you know, some of them are the same, some of them are different. Some of the things you put up here are going to depend on the size of the organization. A smaller organization is going to have different issues from a larger one. So as long as you keep that in mind, knowing that basically every SWOT analysis is gonna be different. It's not gonna be the same for every organization, or even every department within the organization. But the main thing is to just keep the right mindset. So overall, I think you guys did a good job. See you guys next week.
Dr. Gaines,
Yes.
on your discussion board for